So a little bit about me. I am originally I'm born and raised here in Richmond, Texas, so not far from Katy. But I moved to San Antonio and pursued my bachelor's degree in psychology. Graduated in 2009, and then I certainly waited a little bit to begin my master's program at UTSA. I was there for 3 years from 2013 and then graduated in 2016. And then I didn't test or get my licensure until December of 2016. In between my master's and getting my licensure, I had my first son. So obviously, I was focusing on just recovering and working and managing being a first time mom. But thankfully, I got my licensure and passed. And I'm not a very good test taker, so I was happy to be one and done. Excuse me. A little bit about my work history. I have not always worked in or with postpartum or maternal mental health. Um, I My primary background is working with CPS. I worked with them from 2009 up until 2023. I worked in all aspects of CPS. So, uh, excuse me, family based investigations, conservatorship, adoptions. And then after uh, more than a couple years, I really just didn't like how the agency and the direction it was moving, and it didn't really sit with what I wanted to do with my licensure and my career. So I wanted to make a change. Thankfully, Memorial Herman Katy was looking for a perinatal mental health social worker or someone who has worked with women and children in the past. And that was me. So I was hired on with them in, sorry, that says 2003, but I began working with them in 2023. And then I recently just started volunteering with Postpartum Support International, just doing their social media. So, what is a perinatal social worker? We provide psychosocial support to individuals and families during the perinatal and postpartum periods. I cover multiple floors, or multiple units. So, when I say women's, I'm talking about labor and delivery, I'm talking about OBER, I'm talking about postpartum units. And we don't have a separate nursery. I know some hospitals have a women's side where moms go to recover in postpartum, and then you can, if you want to take a break or if you need help, you can move the babies to a nursery. So we just have moms and babies together. We do have a NICU, and then I also cover pediatrics. And then along with those units, I also cover 2 adult units, but I know we're not here to really talk about that. So I cover literally everyone. And the type of work that I do is certainly different than what you would expect from a typical medical hospital social worker. They're the common medical social worker is really focusing on discharging home, setting up home health, setting up hospice, discharging to skilled nursing, or assisting a family with a nursing home discharge plan, whereas mine is more focused on the therapeutic aspects. So I'm providing resources, I'm providing support. Some of the consults I listed here, these are not all of them, but a majority of these is what I work with. Any of our babies that are admitted to NICU, I see them and I complete a psychosocial assessment with their parents. So that means just confirming all of their information. I'm asking about, are you working, or are you taking maternity leave? Are you connected with any resources in the community? Any history with mental health, which I can see from their admission. At the time of admission, I can at least see mom if she has a history of any mental health. Um, and then we do, the hospital gives out EPDS screenings, so Edinburgh postnatal depression screenings to everyone that delivers. And it's just a scale to be completed in the hospital by the mother. And it's not to say that a score will determine if you are depressed or that you will get depressed, but it's helpful for me as the perinatal social worker and the primary OB to see, okay, maybe they're at a higher risk to um, of have postpartum depression or anxiety or any other mental health disorders. I also work with families and parents who have positive urine drug screenings for mom or for baby. Excuse me. I also am consulted for any fetal demises. So that's any deaths 20 weeks or less, and then any neonatal deaths. So that's 28 days or more. And then any history of anxiety or depression, I'm typically consulted by the primary OB, not to come in and do one on one therapy, but really to talk about um, what resources are you accessing? Are you getting any resources? Are you seeing a therapist? What type of medication are you on? Who's managing that medication? Just making sure that before they leave as a hospital, we've covered all of those bases and given as much information as we could. And then I also see families who want to make the decision to leave AMA or against medical advice. We've had a couple, excuse me, a couple families in our NICU and in our postpartum unit who the recommendation is to stay another 24 hours, and the families absolutely refuse. And then they decide to leave against medical advice. Then I'm also consulted for any domestic violence or sexual assault victims, or if they have a history of domestic violence or sexual assault, or even if the admitting OB thinks that they might be a victim of sexual assault or domestic violence or human trafficking. I'm consulted for those types of things too. So here's just some ongoing support. I am not an LCSW, I'm an LMSW. I do plan and hope to test in December of this year. Still have yet to schedule that exam. And I'm also seeking my perinatal mental health certification. This is not a required certification for perinatal social workers, but it is helpful to have, just as like an LCSW, to have those letters behind your name to show that I've gone through the training and I've gone through the education to say that I'm an expert. I've done all the training. Am I an expert? No, I'm still learning. I still like to go to trainings. I still like to connect and network. And I still have questions about stuff that I don't know how to do or I've never come across. But the perinatal mental health certification is just, something that's an accolade to add to my name. I worked hard for it. So I am hopefully to be testing after I get my LCSW, either December or January. And then I just wanted to highlight some of the resources and organizations that I often refer my families to. Sorry, my dog's in here. I mentioned before Postpartum Support International. They have a Texas chapter. They do a really great job. Sorry, hold on. Sorry, he's usually like physically attached to me at all times. So Postpartum Support International, they have a Texas chapter. They do a really great job of connecting families with volunteers who have been through any experience that you could imagine. We're talking about people of color, neonatal deaths, same-sex partners, grieving fathers, grieving grandparents. There are groups and volunteers for everyone. They're always still looking for volunteers to help run a group or to help with their support line hotline that they have. Another one here in Texas is specifically Katy. It's a nonprofit, Mothers of Held Angels. This is a nonprofit run by mothers who have lost their children after delivery, and they meet once a month. They have a podcast. They do different benefits throughout the year, but it's just a great resource for parents to be connected to have a community that has lost a child just as they have. Hand to Hold NICU is a new one that I've just started working with and participating in trainings with. But they do a really good job of not only providing support to the families in NICUs across Texas, but also providing mental health support to the nursing staff or the doctors or social workers, or some even have psychiatrists on board in some hospitals. But just making sure that they're trauma informed and that they're being taken care of too. Um, I've also recently started participating in the Greater Houston Maternal Behavioral Health Roundtable. So this is just a group of organizations that meet quarterly. Our next one is next week, actually, just for a couple of hours to talk about what's going on with the legislature. We get updates about that, or any new updates about organizations coming along. We highlight a specific organization maybe that day. Right now, we're working on hosting a postpartum mental health summit in sometime 2026. This is still on the ground level. We're working on getting presenters, but we're expecting it to be a big in person and available online summit experience for providers to participate in, for parents to participate in, social workers, any medical staff possible. Doulas are also, we're looking for them to participate also. And might be it.
Thank you, Mary.
Right. Thank you. Mary.
I have a question kind of, or can you explain to them, I guess, when you walk into work, what do you do to get your day started? And once you get it started, what does it look like? Are you with babies? Are you with women? Can you tell them a little bit about that?
Yeah. So once I get into work, I am looking through my units. So my first unit is labor and delivery. I'm specifically looking at that. Upon admission, everyone gets a history and physical, reason why you're here, and any history or medical history that the hospital itself and those that will assist in your care need to know about. So in my case, I'm looking specifically about baby's gestational age. If I see that you are admitted to labor and delivery at 15 weeks, I have a red flag that goes off that immediately tells me this is going to be a death, or I need to mark it and look for it, because it could be that medical care is provided and there's no labor induced. And so in labor and delivery, I am typically consulted for fetal demises, and that means that there's a death. I will say our hospital has a really great bereavement, labor, and delivery staff. So there's a primary nurse that is specifically trained, and that is all she does is infant death. So she does a really good job of being in the labor and delivery room with a family. She is there with them until they leave the hospital. But she's also coordinating funeral arrangements for them, or really just being there with the family in silence sometimes. And we alternate sometimes, but her primary role is to be there in the room with the families. And I am usually a backup if she is busy or if she has something going on. I can be of assistance. So that's really what I look for in labor and delivery. In postpartum, I am looking at, I'm sorry, go back to labor and delivery. I'm also looking at in the history and physical, if they have a history of anxiety or depression or bipolar, because that tells me when they are given an Edinburgh screening, depression screening in postpartum, that it could be high. So anything 9 or above is what our hospital policy deems as high and needs a consult for social work. So I'm looking for those clues. Postpartum, when I look at my patients, I'm looking at those Edinburgh screenings. So anything 9 or above, I am consulted for. Um, at our hospital, we do have a psych response unit who sees our patients who are suicidal, homicidal, or who have any type of passive suicide. They're consulted for them too. So anything 14 or above, the OB physicians can consult psych response to come and do a more thorough, in depth, possibly couple hours long assessment with the patient and family. They'll get collaterals from them as well. um, Postpartum, I'm also, again, looking for those positive urine drug screens. So, it, any person that comes in with no prenatal care, our hospital policy says that we can drug test you, or limited prenatal care. Maybe they started at 20 weeks, we can drug test, or if you have a history of substance abuse, we can drug test. Um, so I'll get messages from physicians that so and so had a positive marijuana. I'll go in, visit with them. I am very upfront and will let them know, due to your positive urine drug screen, I am obligated to report to our Texas Department of Family and Protective Services. And I'll say, with my background with CPS, working for them for so long, I will mention that and let them know, do you have any questions? Is there anything I can answer for you? Because nobody wants to hear that CPS is going to be called by the hospital, because immediately some people think, you're going to take my baby while I'm in the hospital. And I just remind them that that's not the case always. It can happen, but it just depends on what CPS decides at that point. Um, and then, of course, our domestic violence, sexual assault victims. I don't have as many of those, not as much as NICU admissions or Edinburgh screenings or urine drug screenings, but they do come, and those, there's not really a template to follow. If that is something that, I meet with a patient, and how that conversation goes, either I'm guiding it or they're guiding it. Being sensitive to different topics, trying to build rapport is key, just so they can trust and give information to you. Um, and NICU, any of those that are admitted, any babies that are admitted to NICU for anything, I see them. And that's more of an assessment with the parents, but just talking about um, uh, their support system at home. Because having a baby in the NICU and being admitted can be really traumatizing. And some stay there. We have one that's been there for 4 months. So having your baby delivered and you don't get that skin to skin contact immediately, but rush to NICU with assistance for breathing, and being born so small, that it can be really traumatizing. And parents, we just want to make sure what your support system is like at home.
Thank you. I kind of want you to talk about a little bit about, when we get adoptions or people want to surrender their babies, because that was something that happened to me when Mary wasn't there. So I was kind of all over the place. So I think it's important to kind of let them know, kind of, I guess, how to kind of navigate that, when it's just like the fire is just steady burning. They want to surrender the baby, and everybody's around you is just kind of feeling the pressure. So could you talk about that a little bit too? About like what that looks like for you when people want to set their babies up for adoption. Oh, you went on mute. Let me see. Okay.
Okay, sorry, that's clearing my throat. Yeah, so we do have adoptions at our hospital. Most of the time, our hospital legal team knows about an adoption. It's hardly ever a surprise. But there have been at least 2 times that it's been a surprise. And I think both of those times I haven't been there. Um, so if we do get a parent that comes in that does want adoption, it is very clear in our hospital policy that we are in no, at my role is in no way there to convince for or against an adoption. I am simply there to facilitate and to um, do what the parent wants. So if we get in instances we get a mom who wants an adoption, I will still do my basic assessment with her, provide postpartum mental health support to her where she can access resources if she needs it. Um, and then if she doesn't already have an adoption agency that she has picked out or that she's researched before she's come in, then I'm giving her a list of adoption agencies. It is not my role or place to recommend one. It is not my place to call an adoption agency for her. The patient is the only one that can initiate adoption or talking to an adoption agency. So they can reach out to the adoption agency, and then once they have one secured, most of the time they come to the hospital to sign documents with the family. And then I'm also meeting with them too. We've got a couple forms on our end that the parent will need to sign because even though a parent agrees to an adoption, and they sign consents with the adoption agency, until that parent's rights are terminated, the adoption means nothing. Just because you called and you talked to an adoption agency does not mean that adoption is granted. Just because you sign consents agreeing to the adoption does not mean the adoption is legal or confirmed. Until the hospital or I or our legal team receives an order for termination of rights signed by a judge, then that the adoption is complete. So at any point in time, if a mom has already talked with an adoption agency, signed consents, but is now starting to rethink her decision, she can do that. The adoption is not complete until it is written and signed by a judge.
Thank you. Okay, so at this time, I'm going to open the floor for any questions. Aisha hand is up, so we'll start with her. But if you have any questions, please raise your hand and I'll do my best to make sure that we go in order. Also, feel free to put questions in the chat too. Okay, Aisha, I'm gonna ask you to unmute. Okay, something should pop up. Okay.
Okay, yeah, you did it. Um, Hi Mary. So I wanted to ask, do you have a certain number of caseload you carry, or is it like do every day look the same for you, or is it like different?
Um, I don't have a specific I have however many patients are on the floor. So let's see. I think labor and delivery there's a total of 12 beds. So those 12 are mine. Postpartum there's a total of 26 beds. So if all of those beds are full, all of those patients are mine. It just depends on who is there in the room. And no, I mean, not every day looks the same. I will say I get the most consults that I get is for NICU assessments because our NICU is growing. I think we're up to 32, 33 beds. And I get a lot of, well, not a lot, but I do get a handful of positive urine drug screens throughout the month. So those are probably my top two that I get. And I, the other floors are med surge in a hospital. So their primary goal is discharging to home or SNF or hospice or whatever it may be. My floor, I function off of consults. So I am specifically consulted for something specific that the doctor wants me to meet this patient about or with. And every now and then I'll get a phone call asking a question about Should this be reported? Should the hospital intervene? Should we do something? But most of the time, I am operating on what my to-do list looks like.
Okay, and I'm sorry, I have one more really question, Leandra. Are you working hand in hand with the social worker who are like on, I guess, regular floors, working with the parents, who has postpartum or, maybe stillbirth or anything of that nature? How does a discharge plan look like? Is it like a regular discharge plan where you send them home with resources, or you following up? Like, what does that look like?
Yeah, so if we have a family that delivers and it is a fetal demise, the labor and delivery bereavement nurse coordinates with them about what funeral home that the family wants, and the hospital will talk with that funeral home about delivering a baby or picking up baby and coordinate it that way. Otherwise, once that patient is medically ready to discharge, then they can go home. There's no special discharge need for them. I am providing resources specifically just about managing, um, a fetal demise, and talking to some people have kids already and who have a demise or have a death. So I'm giving out resources about how to talk to your children about that, or how to talk to parents or other family members about it. Um, so
Thank
And
you.
uh,
you're welcome.
Charlotte has a question. And then I seen one in the chat. After Charlotte, I asked a question in the chat. Uh-oh, Charlotte, you can come off mute.
Hey, so I just wanted to ask a question about like your mental health side of things because in maternal social work, you like you stated, you run into a lot. You run into like the fetal death and people giving up their children and dealing with parents who are on drugs and things like that. Like how does that affect your mental health, or how do you keep your mental health in check while you are dealing with all those different type of circumstances on a day to day?
That's a really good question. I will attribute my disassociation to working with CPS. So, having worked with them for almost 12 years, it's probably not the healthiest, but I feel like I can disassociate between work and home. Um, Really, the only thing that probably triggers me, just because of my own experience with my boys, I had really bad like postpartum anxiety after the birth of my second one. So when you hear, at least for me, when I hear a mom who's young and this is her first or second child, and she didn't experience it with the first one, and then now is starting to talk about having feelings of anxiety or depression, that's probably what triggers me the most, because I have lived through that and I know what it's like. I know what she's probably feeling, or what she will be feeling, and so ironically, just the hearing the postpartum anxiety and depression discussions by families is what really triggers me.
Thank you.
Okay. Uh, Daria asked, she said, hello. She have two questions. How long did it take you to receive your perinatal mental health certificate? And how many years of experience, or hold on, how many years of prior experience, or where should you have experience at to work as a to work in the perinatal side of social work? I think I'm screwing that word up, but you know what I'm trying to say, Mary.
Yeah. So I don't have my perinatal mental health certificate yet. I've just done the trainings. So Postpartum Support International, it offers international training via Zoom, or you can do it in person in some states. But check out their website. They have a program available There is a 2-day training that I did virtually, and then there is a 1-day training that you do virtually. Um, or if it's in your state, you can do it in person too, whichever you prefer. I just didn't have that option here in Texas. Um, they are very costly, but if you are able to connect with your, thank you, Stephanie. If you are able to connect with your local chapter and ask or email some of them about any scholarships that are available, that's how I was able to do my trainings. I think the 2-day training is like $500. The 1-day training was almost $300, but I was able to submit a scholarship application, and I got scholarships for both of those trainings. So connect with your local PSI chapter. Let me go back to that second part of the question. I didn't have any prior experience working in perinatal mental health. If you remember, my background is primarily working with CPS. So I guess you could say there was a little bit of background working with children and families, but truthfully, I had no prior experience working with an OB office or working with a doula agency or any maternal fetal medicine none whatsoever. It's definitely different and a different type of social work than what our other like med surg social workers do. It sounds so silly, but I really just had a passion just from my own experience wanting to create change and provide support to these parents. And what better way in a hospital setting after you've delivered? I can be that first point of contact to say, hey, how's your mental health? Here's some resources if you don't know already. Because if you think about it, most of the time, parents aren't following up with a provider until I think 6 weeks after delivery. Even the pediatrician, they're not following up for a week after delivery. And half of the time, those appointments are, how are you and your baby doing physically versus, how have you been managing with your new baby at home? How has your mental health been? So really, it just comes from a passion of wanting to be that first person that asks those parents, like, this is really hard and it can be hard, but here are some great tools that you can use.
Thank you. We have 2 hands raised. We'll go with them and then we'll go back to the chat. Miss Stephanie, I saw your hand first.
Okay, so I'm gonna mute myself for this one. And, hello everyone. So I have 2 real questions. I'm actually a social work student right now in New York. I'm studying for my master's in social work at St. Joseph University in Long Island. So my 2 questions, first is like, what kind of advice would you give a social work student who's interested in maternity or prenatal mental health?
Excuse me. I would start with checking out Postpartum Support International. Again, they have great trainings available. I would also just do a simple Google search of within your state or within your county of where you live of postpartum mental health resources. Just learning about what is available, what nonprofits are available, what your community is doing to battle or to provide resources and support to those experiencing postpartum mental health. I would really just start there, see what's available, see what's out there. As I've been in this position, I've grown to learn that it's minimal in our county, as big as Harris County is. And so Deandra's been there where I've had my episodes of just being like creative and this is what I want to do. And so really just learning about what is available in your city and in your county and in your state. And I guarantee you there's lots of resources available to help you understand what you can do as a student and as a professional just to help grow the resource.
And I want to add on to that too, Mary. Maybe you could even search for like maybe some like whatever resources you find, see if there's an opportunity to intern or volunteer, or either volunteer in like the women's department or with the babies or something, just to kind of see what it looks like. Maybe try to shadow a social worker there too to kind of make those connections. Sorry, Mary.
No, that's okay. And I was also going to suggest too. I keep going back to Postpartum Support International, but the volunteers that they have available, there's no real. Some of them, yes, have real and specific criteria of how you can volunteer to lead a group, or but most of the time it's if you check out the website and what's available in your chapter, it is you'll see just a lot of people, whether they have children or not, want to be a resource and support for those who are going through anxiety or depression or psychosis or fetal demise. So there's lots of ways to get involved with Postpartum Support International.
Oh, that was actually, I'm still actually looking because I want to actually look into it for my second year. But my follow-up question would be like, how do you feel like any current trends or challenges to the profession like that you are aware of? Because you mentioned you've been in the field for some time prior to you becoming a prenatal social worker or maternal. I wanted to know if there's been any changes that you've noticed or patterns, so to speak.
Um, I have noticed that there, and I could be wrong just because I'm, kind of stuck in my own bubble in Katy, but I've definitely noticed that there is a growing trend. And now that I've become a part of a lot of these communities like Postpartum Support International, and once you get a part of that, or like Hand to Hold NICU, being a part of that community, you notice that there are more and more people out there who are wanting to help battle and bring awareness to perinatal mental health. Um, when I had my son 9 years ago, is my oldest son, my youngest son is 6. I truly do not remember being asked any questions about my mental health, how I was doing, how we were doing at home. Even with the birth of my second son, I don't remember being asked any of those questions. Now, parents get that Edinburgh screening there in shortly after delivery, which can be helpful. But most of the time, parents are just filling it out because they want to discharge, and that's fine too. We can't really control that. But now they're getting those screenings at the pediatrician's office almost up to a year after birth. You're noticing if I have personally, if I see a patient and if it's giving me a gut feeling that they need to follow up with their OB, or the OB needs to ask these follow up questions, I am messaging the OB after my assessment with them to let them know, hey, next time they come to your appointment, please check in with them, give them resources. So I feel like I'm being proactive in that way too. But I've just noticed that being a part of more of these communities, that the more people that get involved, the more awareness it brings.
Does that answer your question, Stephen?
Yes, it actually did. Thank you.
Thank you. Next is Miss Henry, and then we'll go to Miss Wright. Uh-oh. Did I lose her off my screen? Okay, I think I lost her. She was just, oh wait, there she is. Let me see. Miss Henry, do you still have a question? Or is that my mistake? Okay, if it was, oh, she's coming off mute.
Can you hear me? That's what I want to know.
Yes, we can hear you now.
Okay, thank you. Okay, because this is my second degree and I do have experience working in the hospital field, my question to you, Mary, Did you, if you had it over to do it again, would you go through the CPS route and then the hospital setting, or vice versa?
I at the time when CPS was a way for me to get a full time job. Um,
Okay,
I was in San Antonio, in Bexar County, which is similar in size to Harris County. So it was an opening. I needed insurance and I needed an income. Over
uh,
time, that job was very rewarding. I will give it that. But as I got towards the end of my career, I was a supervisor, and the only other position was a program director, and I didn't like what was happening within that agency. If I had an
okay,
opportunity to have been involved with a hospital setting, or if I had known that this was a thing, I would have gotten into it. But I didn't have my first son until after my undergrad, so I didn't know that it was a thing.
okay, because I have two opportunities. One, either to work in a hospital setting or CPS. My thing is they're both caseload is humongous. So as coming out new, I'm just wanting to make sure which avenue I want to go down, or which fields I want to partake in.
Yeah, there's advantages and disadvantages to both. I don't work nearly as much now as I did working with CPS. But I will say, on the weekends, I'm not on call, but the director of women's and the managers in women's kind of look to me as the expert. And so every now and then I'll get some text messages or phone calls on the weekends, which I don't mind because I was used to that being a supervisor with CPS. But I don't feel like I don't have to bring the work home with me like I do with CPS. When I worked with CPS, my tablet came home with me, my work phone came home with me. I was answering emails and phone calls that I probably shouldn't have been on the weekend because it was my time off. Whereas at the hospital, I put my phone in the charger and I'm done.
Right. But would you say the training and the training that you received at CPS kind of helped give you guidance where you are now?
Um, yeah, it definitely made me more aware of just mental health. I'll give it
Mm,
that.
okay. Well, thank you for your time and thank you for the questions.
Of course, thank you.
There was one more question in the chat, and then we'll kind of close for the night. Miss Wright said, "What are some of the major strengths or challenges you would need to work in maternal social work?"
Um, Strengths is, uh, I mean, working in a hospital setting, you're as vulnerable as these patients are in the rooms that you go into. Really and truly, I'm the most vulnerable one walking into these rooms because I only am able to read what I see on your admission. I am the one asking these probing questions sometimes. The patient has their rapport with their OB and already with the nursing staff at that time. So I am just someone new walking in. Um, so probably one of the, I guess, both strengths and challenges is um, being able to build a rapport with the people that you work with and just remembering that they're people. um, yes, they are patients. Yes, sometimes they can have difficult discharges or difficult situations. But just remembering that they are just a person who had a baby who is looking for help. just like a family member or a friend. Some of the challenges could be lack of resources. The one specific one that I get all the time is we have patients, not many, but we have some that come in who don't have car seats. The hospital does not have car seats to give you. I don't have a car seat to give you out of my car. I have one resource in Katy that at the phone call I can call and say I need a car seat, a pack and play, and some stroller, and they will deliver it to me, no questions asked. And that is through a church. Everywhere else, it is a waiting list. It is you as a parent have to take classes before you deliver if you want a car seat or any of these other resources, or if there is an organization on my list of resources, I have to call and see if they have anything available. Sometimes they do, sometimes they don't. That's probably been the biggest thing, is just finding someone who, other than my one resource, that is reliable in getting me a car seat. And the strength is like being able to build these relationships with families. We have families in our NICU that are there long term. We have one there that's been there for 4 months. I try my best to at least check in with those long stayers every couple weeks, just to, hey, it's a mental health check-in. How are you doing? How's everything at home? Is there anything that you need me to email you, or how have you guys been managing coming to and from the hospital when you've got your other kids at home? Who's taking care of those other kids at home? How are your other kids doing at home? What activities are they involved in? And it's also, in this position, helped me realize what more I want to do for our hospital. I am looking at starting a NICU support group for our families next year. I would love to do something like that. I would love to be able to just have some downtime with our families in the NICU, start a weekly night dinner, making it more of a community instead of labeling them as patients. We're building a third tower in the next 3 or 4 years. And so that's going to be a pediatric ICU unit. So working more with those pediatric kids who could be discharging home on hospice. So I want to build my rapport with hospice agencies who can work with children. I just want to know more. Anything and everything I can learn, I want to know.
Thank you. I'm gonna go over the last two questions that was asked in the chat. I kind of answered them. Though one was from Ms. Myers. She asked, does your position include any after hours work like CPS? No, Monday through Friday, about 8 to 5. There's a social worker over the weekend who addresses those. It's just consults. So no, it's totally different from CPS.
Yeah.
And then another question about are there positions in the hospital for MSW students? As an intern, I just said yes. That's how kind of I got into this position. I started off as an intern at the hospital, and now I'm a worker there with Mary.
Yeah.
I just see a hand come up. This will be the last question for tonight. I'll make sure I drop Mary's email in the comments in case you want to reach out to her for any additional questions. But we'll take this one and then I'll do some closing remarks. Cassie, you can come off mute.
Okay, so it's not a question, it's more of a comment. Miss Mary, I actually work in the maternal and child health program here in Houston. Um, and it's actually through Harris County Public Health. It's a free program. We do offer the support for maternal mental health and just the support overall, because sometimes mothers don't have the support of family. So we do go into a home, like it's a home visitation program, and we do all of that. And I would definitely send you the information over.
Thank you. I feel like I've made a referral to you all before. What's the name of the organization? I'm sorry.
Oh, Harris County Public Health,
Oh,
the
okay.
maternal
I
child
know.
health program.
Yes, I feel like I am familiar. We have another social worker at our Southwest hospital that sends us good at Memorial Hermann Southwest is always sending us good information. So yeah, please send it my way. I'd love to be able to connect and refer to.
Okay.
All right, thank you. All right, well, that will conclude our session. This is our last meeting for the year of 2025. So we appreciate all the support that we've been getting. And thank you again, Mary, for taking out the time of being a mom to come and pay it forward. We really appreciate it. A few things that I just want to announce. Our next event will be in January. It'll be with the ASWB. I'm not 100% sure of the topic right now, but I know that NA not NA ASWB will be coming to do a presentation to kind of talk to us about some things to expect in social work in the future. And then also we'll be having some executive positions coming open soon. We are looking to make a transition. So if you're interested, stay on the lookout for that on our socials. Um, Also, before I end this Zoom, I want to again take the time to recognize any faculty or staff members on from any institutions. If you'd like to come off mute for a second to say a few words, we would appreciate it. Okie doke.
Did an amazing job, Mary. I'll say that. I know that you were a tad bit nervous, like you mentioned, but seriously, we really do appreciate you taking the time to at least explain the position. Because to be honest with you, I didn't know much about the program. I didn't know much about maternity social work until I want to say maybe a couple weeks ago. So I really do appreciate you explaining like the procedure and the background because this it is something that I'm looking into um my upcoming year. Hopefully by next year I should be in.
Oh, see, Mary, I told you it'd be fine.
Yeah, you had nothing to worry about. You did an amazing job, seriously. And again, one of the biggest things that I understand that, this type of program exists because unfortunately it is not something that is explained to incoming social workers. We kind of just figure it out through the grapevine. So the fact that you are willing to take the time and explain a lot of the questions that generally speaking is not even taught in classes, we kind of find out through, colleagues or through looking up resources. That's what we do. So again, I really appreciate you taking that time and explaining it to all of us, me in particular. But I couldn't imagine a better speaker.
Oh,
Oh, thank you. I appreciate it.
oh. Okay, guys. Well, thank you all for your time. I hope you all have a wonderful night. In the chat before you leave, if you're looking for ways to stay connected, Charlicia has dropped some of our socials in our group me chat in there. So feel free to join and connect with us there. If not, we'll see you all in 2026. Merry Christmas, Happy New Year, and anything in between. Oh, Happy Thanksgiving. Bye.